Hi, this is Glenn Gruby with the Functional Health and Acupuncture Institute, and continuing with our thyroid education series. Today we're going to talk about digestion. This is a really important topic because poor digestion can affect your ability to make thyroid hormone, and hypothyroidism can also cause poor digestion, and it can be a bit of a self-reinforcing loop. So, couple things. Hypothyroidism really has an overall significant impact on digestive function, but it's often overlooked. We often kind of think of these as separate issues, but as I kind of mentioned, they are not. They affect each other tremendously. They need to be looked at as one problem. Most hypothyroidism occurs secondary to an autoimmune disease known as Hashimoto's thyroiditis, and we know that 70% of your immune system is contained within your digestive tract, and so this is an important area to investigate, especially if you do have a autoimmune disease. And the severity of your symptoms can be based on the severity of even your gut health, but also other things, how much exercise you're doing, health, how your overall health is, lifestyle management, but the health of the gut relates to the health of your symptoms. So if we start up at the esophagus, which is the tube that connects your mouth to the stomach, we can have problems here with hypothyroidism. You can have difficulty swallowing because the rhythmic contractions or peristalsis can be slowed down due to a connection between your brain, the nerve from your brain and your digestive system. That can also cause delayed gastric emptying, where the contents of your stomach don't leave fast enough, and that can cause gas and bloating. You can have decreased stomach acid production, and this is important. This actually can cause heartburn. People don't often think of that, but it's true. You can have heartburn very commonly because decreased stomach acid production. But the stomach acid is also important for nutrient absorption and for protecting us against infection. And decreased transit into the small intestine, the rhythm of the small intestinal tract can be affected as well. And if we look into the intestines and colon, you can have a reduced appetite. You can actually get more calories from your food because if the food is not moving along as well. And constipation is a typical problem with hypothyroidism. One of the problems with this is that you are also going to be exposed to more toxicity because you're not moving your food along fast enough. Many patients will report bloating and discomfort, and this can be cause of poor digestion and also a poor mix of healthy gut bacteria, and the bacteria are then really digesting the food faster than you are absorbing it, and they create a lot of gas and bloating. You can have increased muscle pains due to intestinal wall infiltration, which is really just an inflammation of the intestinal wall. And as I said, you can have changes in the gut microbiome. This is a very important topic. The health of your nervous system and your brain and your even things like your blood sugar balance is affected by the type of bacteria that you have in your gut. So this is an important thing to look at. You can also, in some cases, have intestinal bleeding. Thyroid hormone is important and necessary for you to produce the blood cells necessary for clotting, and this can be affected with hypothyroidism. And if we look at the liver is partly a digestive organ because it does produce bile, and it also helps to take your digested food and produce glucose for energy, and it's also important for detoxification. But actually, the liver is the most affected organ in hypothyroidism. It's very sensitive to thyroid hormone, and many things can go wrong, which we'll look at here. You can get a decreased oxygenation of the liver, causing it to become less active and affect its ability to detoxify the body. You can get decreased production of glucose stores that would affect your overall energy levels. You get increased cholesterol production, and it's very common to see high cholesterol, and that can be secondary to hypothyroidism. So it's not necessarily a good idea to just take a statin drug or something for high cholesterol without checking the status of the thyroid. You can have an increased incidences of gallstones and gallbladder issues, partly because you're not producing enough bile or slow bile movement. You're having increased stagnation of your bile flow. That affects your ability to digest fats and fat-soluble vitamins. You can get nutrient deficiencies, dry skin, hormone imbalances, and finally, as we said, you can have compromised liver detoxification, and that can increase the problems with autoimmune diseases and inflammation. Other issues that can come up, hypothyroid patients are much more likely to get a disease known as celiac disease. It's an autoimmune disease, and in general, 50% of Hashimoto's patients go on to develop another autoimmune disease in their lifetime. Pernicious anemia is quite common. This is a B12 related issue. We can't absorb the B12, and we also then can't absorb the iron. There can be oral bacterial overgrowth in your mouth. Certain bacteria can colonize in the mouth, and this can also affect autoimmune or make you more likely to have autoimmune diseases. Constipation can cause problems with the bacteria mix in your gut, and really we need to have at least one bowel movement a day. If you have had only 2 or 3 or 1 a week, even if that's been your way your whole life, that's not a good thing. You want to change that. Not enough bowel movements just allows the toxic material that's trying to get out to stay in your system longer, and that can actually even cause an increased risk of colon cancer and other cancers. And the thing is, often of these things are overlooked or dismissed as separate from thyroid issues, but they're not, and you really don't have to deal with these GI problems. There's a lot that can be done to help them and to improve your digestion. And the important thing to remember is that ultimately the health of your GI system determines your overall health. You cannot be healthy without a healthy digestive tract. So that's the takeaway for this short video. I want to thank you for watching. If you have any questions, you can call us or look us up online at FHAInstitute.com, and thank you again.